Women are twice as likely to develop panic disorder, and this risk can increase during perimenopause due to hormonal changes. So what causes panic disorder and how can you treat this condition? Hi, I'm Dr. Aram, an integrative psychiatrist and lifestyle physician. Meet Danielle, a 42-year-old mom who thought she was losing her mind. 6 months ago, she was sitting at a red light when her world turned upside down. Her heart started racing like she'd sprinted a mile, her chest tightened, her hands went numb, she broke out in a cold sweat and couldn't breathe. Her vision blurred, she became dizzy and disoriented. She was convinced she was having a heart attack or stroke. It lasted less than 10 minutes, but felt like an eternity. But this wasn't the first time. Over 6 months, Danielle experienced several terrifying episodes. Each time she experienced several symptoms, including palpitations, shortness of breath, chest pain, dizziness, chills, and the terrifying sense that she was losing control or going crazy. Since her first attack, Danielle developed a deep fear of when the next one might strike. She began avoiding crowded places, she pulled back from social events, she even stopped driving alone. This fear started controlling her life. Danielle was experiencing panic disorder, and it started right around the time her periods became irregular. To compound her situation, she was sleeping poorly, only getting about 4 hours a night. Her mood was up and down, and she had gained weight after IVF treatments. Here's what's really happening. During perimenopause, estrogen levels fluctuate wildly before the drop. Think of estrogen as your brain's natural anxiety medication. When it starts declining, your brain's fear center, the amygdala, becomes hyperactive. Research shows that women are twice as likely to develop panic disorder during perimenopause compared to their younger years. Yet most doctors never make this connection. So how did we get Danielle feeling better? First, we stabilized the nervous system. Danielle described her brain as feeling like a phone with a dying battery, constantly on edge, never fully charged. We started a low-dose SSRI to give her brain the serotonin boost it needed. Second, we focused on sleep. 4 hours a night was keeping her stress hormones high. We implemented a wind-down routine and used trazodone as needed for sleep. Within 2 weeks, she was consistently getting 6 to 7 hours. Third, we addressed her hormonal imbalance. We conducted comprehensive hormone testing, including estrogen, progesterone, and testosterone. We discussed hormone replacement therapy to smooth out those wild fluctuations. Additionally, Danielle's micronutrient testing revealed that she was severely deficient in certain micronutrients. We supplemented with magnesium and vitamin D as both were low. A month later, Danielle showed up for her follow-up appointment feeling much better. She said, "I drove to the grocery store alone today. First time in months, I didn't feel afraid and overwhelmed." Treatment for panic disorder involves a comprehensive approach combining therapy, medications, and lifestyle changes. The gold standard treatment is cognitive behavioral therapy, or CBT, which helps you understand what triggers your panic attacks and teaches you new ways to respond to anxiety. For medications, we typically start with SSRIs, antidepressants like Prozac, Zoloft, or Lexapro. These are quite effective for panic disorder. SNRIs like Effexor are another option. For immediate relief during severe episodes, we might use short-term benzodiazepines like Xanax or Klonopin. However, these require careful monitoring due to dependence. But here's what I emphasize with all my patients. Medications and therapy work best when combined with lifestyle medicine. Quality sleep is non-negotiable. Regular exercise acts like a natural anti-anxiety and antidepressant. A nutrient-dense diet supports your brain chemistry, and techniques like deep breathing, grounding exercises, and mindfulness can help control an actual panic attack. The key is working with your doctor to find the right combination for you. Some patients do well with therapy alone, others need medications. Zoloft is an SSRI we use commonly for treating panic disorder. This next video sheds more light on this medication.